Please start.
Hi, everyone, and very good evening to all of you. I hope that you are in a good health. And just to introduce our mentors today, myself, Dr. Praveen, and with me is Dr. Saurabh Bhatia, our ace of pharmacology. And with me is also Dr. Naseer, whose blueprints are so famous now that he's named by the blueprints of Dr. Naseer. He has his own unique way of teaching. And Dr. Saurabh is always known for his lovely smile that he has. So this video is all about the how to ace your second year preparation, what we can have brought you in our current video series. What is special about in this second year video that's called concept videos, how it will help you not only to ace your second prof exams, but also how it will help you to get a very good result in the NEET PG, and mostly that you'll be for the next exam. How are we integrating our teaching with the vertical integration, that is with the other subjects like medicine and surgery, gynae, pediatrics. And also we'll talk about the horizontal integration, in which we'll talk about how we have integrated our teaching in second prof and also in the first prof. To talk about this, I will first ask Dr. Saurabh Bhatia and Dr. Naseer to just say a bit hi to our dear students who have met us, sir. Dr. Saurabh Bhatia.
Hello to everyone. My dear students, how are you? How's everyone? So this side, Dr. Saurabh Bhatia, and I am your pharmacology guru in this app. So in this video, like Dr. Praveen has already mentioned, like we have recorded all these videos considering the fact the clinical importance of the subjects which is gaining. People are asking the clinical things. So a lot of horizontal and the vertical integrations are there with the different subjects, different fields. And you people will definitely fall in love with these videos. Dr. Naseer.
So hello everyone, hope all of you are doing fine. So we are here to tell you that how to prepare for second year MBBS along with the NEET or next, whatever is coming up with for the entrance examination. Because as a student at this point of time, it will be confusion, right? You will be in a confusion that how to read, how to proceed forward. So now everybody will be having an intention that I want to do better, I want to take a good PG seat, but proper guidance is very important. See, everybody does the hard work, but doing hard work in the right direction, that will lead to the destination. You are doing the hard work, but if you are in the wrong direction, then obviously you never reach the destination, how long you do the hard work. So that's why we are here to show you the proper direction, how to prepare for second year MBBS along with entrance examination, and how to integrate horizontally and vertically with other subjects, how we have to study second year subjects in relation with clinical subjects, that is the third year and final year subjects, that is horizontal integration. So stay with us for some more time, so we'll come to know how to move ahead.
Thanks, Dr. Naseer. And I really I'm thankful to both of you for sparing us time, because second year is a time when every student's in a fix. He has just come from the first year, where I think, sir, we have all faced it. First year में time कैसे निकल जाता है, we don't understand that. There is अब तो उतना ragging नहीं होता. I should not use the word ragging, but I should use the word introduction for the first year students. And then comes the main first prof, and then they get to know how tough the actual prof exams are. When they read the second year, I think one advice that everyone gives to a second year student is to read the textbook cover to cover. I think everyone has given this advice of reading Robbins cover to cover, reading K.D. Tripathi cover to cover, and the Panikkar book cover to cover. This is a universal advice throughout India, isn't it?
Definitely, sir. This should be the approach either. Like I just want to share one incident with you people and also with my students. Like when I was in third year, like I started going to the clinical postings, and there I found a resident, the medicine resident, and he was examining a case of acute tonsillitis. So I just asked him, sir, what exactly the case is? And he showed me that this is acute tonsillitis and we have to treat it. Then in discussion, I just asked him, sir, why it is important to read about the first and second year subjects. So he asked me to come here. Then I went close to him and he said, now look at this. This is a red swelling. I said, yes. Now he asked me whether it's acute inflammation or chronic inflammation. Then at that time I didn't know. So I said, sir, I don't know about it. Kehta, if you have read the Robbins, then you should be knowing about this. So Kehta, this is the importance of pathology, that you should know that it's acute inflammation. The symptoms are red. The patient is having the painful lesions. So it is acute tonsillitis. Then he asked me which bacteria are involved, which organisms are involved. Then I said, sir, I don't know. Then he said that you should be knowing from your microbiology. Now go and read the microbiology. You should come to know it's a gram-positive bacteria. Some gram-negatives can also be involved. Then he asked me, okay, fine. Now you know the disease status. You know the now you know the cause of that organism, positive organism also. Then he asked me, tell me which treatment will you give? Tell me the name of the antibiotic. So right now I know about the antibiotic, which antibiotic is best to use. But he's told me this is the importance of second year. Like 90% of your MBBS will be covered in the second year only. Like if you know the drug pathophysiology, you know the drug microbiology, you know how to treat a particular disease. Now this, half of your MBBS is over here. So second year is just, I just want to say second year is the main foundation of your MBBS. Like if you know about a drug pathology, microbiology, pharmacology, what else you want? You just want to diagnose the patient. This is what you will learn in the third and fourth year. Because once these people will enter, like once the student will enter in third and fourth year, then we people will not get time to look back. Like we people will not get time to read this pathology and pharma and microbiology again. So this is the time to build the foundation. If we have the strong foundation, then we are confident enough to diagnose a case. We are confident enough to know like which bacteria are involved. We are confident enough to give a drug that this medicine is going to treat my patient. Medicine is not going to cause any side effect in the patient. So I think, my dear students, second year is a main foundation where you have to read the books from cover to cover. And this is what our approach is. Like while recording the videos, all three of us, we people sit together so many times. We people decided as if we people are in second year and what all information we should know. And accordingly, we have recorded the videos definitely horizontally, like I'm just connected all these three subjects, as well as the vertically also. Like Dr. Naseer will teach you in the video what is a meningitis, how to diagnose the meningitis, and sir, you will tell me which all cells you will observe in the CSF fluid, and I will teach them which drugs need to be given for as an antibiotic. So this is the approach which we have followed. Like we are a second year student and we have to learn all these things. Dr. Naseer, what's your comment about this?
Obviously, no doubt in that. I always tell students, whether willingly or unwillingly, whether by chance or by choice, if you have become a medico, right? I don't know whether you have read it first year MBBS, you have read it or not properly, but in future also whether you read it properly or not, I don't know. But second year is the one where you have to read, you have to put your extra efforts, maximum efforts. You should not take your life granted, because entire medical field is dependent on second year subjects. Second year subjects are like foundation subjects. Remaining all subjects is like the upper building, what you see. But if foundation is not strong, even if your building is very strong, it will fall one or in some time. So that's why you have to make your foundation strong. So you're starting your second year MBBS, be thorough with patho, pharma, micro. That is all that is the entire medical field. Sir, Praveen sir.
Right, बिल्कुल सही बोला sir कि I think we have, and everyone who is actually pursuing MBBS, they know the importance of the second year subjects. They know how important it is to read the microbiology, pharma, and pathology to make the concept clear. Now, coming to our videos and why it is special when it is launching, what is special about it? I'll start with myself. So when I started recording the concept videos of second year, I thought like, if suppose I am a second year student, what would I like this video to be? And I thought, everyone says ki yaar Robbins padhna hai, but it's not so easy because the language is tough, but the concepts are so important. So I made one point that I'll not even leave a single chapter of Robbins. At the same time, I won't leave even a paragraph of Robbins, but I won't teach the textbook. What I'll do is I will teach the same thing in my own way, making it more simplified, just making it in a way so lucid that it becomes very easy for any student to understand. So I have ensured that I have taught you every single concept of the second prof pathology, keeping in mind that the notes making, that becomes very, very easy. So how will that become easy? You know, any textbook writes in a big paragraph form of the things. It's very good to read and understand that. But when it comes to write a question answer in a prof exam, it really becomes very tough. It becomes very simplified when I put the same thing in a table form, when I put the same thing in a flow diagram form. So what I've ensured is that I have, covered every, I'll get you, because when I started recording this video, I myself made all the list of the topic that is actually being asked for the last 5 years of all the prof university exams. I ensure that I also mix the concept of the NEET PG occurring right now and NICT exam occurring right now. So students at the same time also feel that what are they actually studying it for? Okay. So that is one extra thing you will that find in my videos. Now coming to Kisar, whether I will be able to crack the next exam while watching your videos. Dekho, since I have been and we have been teaching this for the last 5 years, I think it has been 10th year right now that I have been teaching the NEET PG students. So I actually know what questions are being asked from the medicine point of view and surgery point of view. So I have completely ensured that those topics of medicine, surgery, pediatrics, and gynae are definitely included in those systemic pathology topics that we are taking that right now. So you can be complete assured of that in a short way. Not I cannot complete the regimen of that treatment, but surely I've ensured that I completely tell you what the treatment would be and how to approach this case if you are a final year student. For example, I'll just give a few examples there. Suppose a patient has come to you with jaundice. So I have started right from the concept of bilirubin metabolism. I have taught you what is the pre-hepatic, hepatic, and the post-hepatic jaundice, the cause of that, the approach to that jaundice case, and ultimately what would you do in the pre-hepatic jaundice, hepatic jaundice, and the post-hepatic jaundice. And this is not only for liver as such. I've just done the same thing for kidney. I've done the same thing for all glomerulonephritis. I've done the same thing for lungs, ARDS, pneumonia, lung tumors. Uh, for the chapter of heart, MI, whatever you just tell me, and it is all there. So you can trust on this video. The really one thing that I would be looking forward when I was in second year student. So I have thought like a second year student, what would make my videos very special for that. After watching these videos, a very first thought that comes to my mind is, sir, what I'm reading right now will actually help in solving the MCQs. Well, I can tell you one thing. So the question bank now is really revamped completely in a way to suit the next appearing students. So when you watch my videos, do solve the MCQ of the same videos from the question bank. It will really make concepts more clear and will feel very confident about it. The third thing I'll tell you about this is all the images. So images are redrawn, and I have made the images very simplified in my own way of teaching. The pink and the blue of pathology has been really made lucid. So that becomes oversimplified. I'll just add one thing, when I was in second year, what happened was we had a batch of 150 students and we had one microscope for 30 students completely, circling that microscope just to have a glimpse of what I see in that microscope. So yes, practical is one important aspect of the second prof students, and that also has been covered in that. So I think that is one complete package you're looking forward, guys. Do not miss the concept videos. It will really make your life, second year life, very, very simplified and better that you approach the case. And just to give a small feedback of what we have received in the last year, students who have watched our videos and appear for the university exams, they have been asked one simple question: यार इतना तूने कहाँ से पढ़ा? हमने तो पढ़ाया नहीं तेरे को. That is one extra, I'll say, a remarkable feedback that we have got from students. I'm very sure that when you watch it, you'll also feel the same. That's all from my side. I will now hand over to Dr. Naseer sir to talk about microbiology and Dr. Saurabh Bhatia sir to talk about pharmacology. Sir, back to you.
Okay, sir. So coming to the my part, microbiology part, right? What I want to say is, see, one thing is, sir, we have many apps available in the market, no doubt in that. But what I say is, if you talk about the eGurukul app, faculty point of view, if I say some reference standard, gold standard, best faculty, मतलब ये भी छोटा पड़ जाएगा. सर हिंदी में बोल सकते हैं आर पार, right? ऐसे faculty तो आपको कहीं भी नहीं मिलेंगे. You won't get faculty, this kind of faculty anywhere else all over India. What we have in our team, that is eGurukul team. The only thing is, being student, आप कैसा utilize करोगे in faculty को, that is what it is ultimately. And second, coming to the in all the apps, sir, all the lectures are available. Why we want to go with eGurukul app? So that's why we are here today to tell you that we have come up with concept videos. Sir, what is the difference between concept videos and the normal recorded videos? That is the first thing we need to know. See, in normal recorded videos, whatever is there, everything is covered in the concept videos also. So whatever we have covered in the normal videos, everything is covered in the concept videos also. But there are few things we won't touch in the normal videos which are required for second year MBBS, because in normal videos, PG videos, that is PG videos, we concentrate more for MCQ based for entrance examination. We less concentrate towards the second prof examination. So that's why we have come up with an idea of concept videos which will help the second prof students, so that They can do their university exam well along with this and along with their entrance examination also. Here we are not compromising on MCQs. Here we are giving an extra preference to second prof exam also. That means some 20% of the content extra covered in the concept videos, which you won't find there. For example, I will give you the example. For example, if I talk about scientist chapter, the first chapter in microbiology, that Louis Pasteur, Robert Koch and all, in my regular videos, I just tell 3 to 4 points, but in concept videos, I will explain in detail so that you can write for 5 marks also, along with the things, whatever we have covered there with MCQ part. Along with the MCQ part, we see to it that you can write it for second year MBBS exam. Right? Similarly, we have many examples. If you talk about the life cycles, in my normal videos, I will show how to identify the life cycle, but I won't teach the life cycles because identifying the life cycle is enough there. No need to draw the entire life cycle. But in second year MBBS, in the prof examination, you have to draw the entire life cycle. So I have to teach you how to draw the entire life cycle. So hope you have understood what is the difference between the normal videos, which is there in the app, and the concept videos, which we have come up in the app. These type of concept videos, along with MCQ, NEET, and next exam, focusing towards prof exam, you won't get in any other app. I'm telling you, DBMCI eGurukul is the only app which has come up with concept videos where we focus on MCQs, entrance exam, that is NEET, and also the next exam, especially the next exam for you people, along with the focus towards the prof exam, so that if you go through these classes, not only you can do very well in prof exams, you can also do awesome in the next exam, what you're going to appear after some time. So this is the first difference. So second difference is, sir, obviously we are not covering entire textbook line to line, point to point here, because if that's the case, you can read textbook on your own. No need to purchase the app or watch the video. Sir, why to attend the classes? Why to watch these videos is because, sir, what to read, what not to read, what is more important, what is less important, what is not important, what not to read, what to read, and among what to read, what is more important, what is less important, how to read. See, the proper guidance is very important, and that is what is smart work. So don't expect that we cover one line to line, but I can tell you more than 90% of the content is covered, right? More than 90, not 90, I'm not telling 90%, more than 90% of the content is covered, whatever is there in the textbook. And whatever is there in these videos is not just enough for prof exam and the upcoming entrance exam, next exam. I say it is more than enough. It is more than enough. You just have to believe in our lectures, and you just have to follow it. The concept videos, it does awesome, and you can do very well in your all exams, whatever you face in your future. Sir, to you, sir. Saurabh, sir.
Definitely, Dr. Naseer, well spoken. So, students, most of the points Dr. Praveen and Dr. Naseer have already covered. So, if I talk about my way of recording the lectures and my way of making this app, so I would say, when I recorded these lectures, even I think like this way, I'm a second year student, and but all things I should be knowing. So apart from that, my basic approach is how to treat a patient. Like after watching these videos, after getting all this content, whatever I have given you in these apps, I bet you one thing, you will be able to write a prescription. You must be knowing, like, but all drugs can be given to a particular patient, because I just want to recall one incident. Like I was in a second year, I was at the end of the second year. At that time, the second year was of around 1.5 years, so more than 1.5 years. So I was about to finish my second year, and one patient came to me and he was having the sore throat. And he asked me, sir, I am having these symptoms. And I just ended up with writing with paracetamol. And at that time, I didn't know about the dose of the paracetamol even. So guys, this should not happen to you, because I felt humiliated at that time, but I don't want my student will feel the same. So I bet you one thing, like after watching this video, you would be knowing which group of medicines are best for this patient, how to write a prescription, what is the proper dose to be written, so that at least, guys, you people are like a kind of honorable persons in this society. Everybody look upon you. Whenever they are suffering from any problem, they look upon you. And if you people will say that I don't know which drug is given, like at the end of the second year, so this does not suit you. So at least my approach is, my student who is watching my video, taking this information, would be able to treat a patient after watching these videos. And plus, if you watch the videos of microbiology pathology, you will be have a holistic knowledge of a disease. You will be able to diagnose a disease. You will be able to know the cause of the disease. Plus, you are able to treat it. Now, as far as the book references are concerned, what I found, like the book KD Tripathi is a book which most of the students follow. So what I have done, I have recorded the lectures in a sequence of the KD Tripathi index. Like if you want to go with the sequence of my videos, you will find the index of the KD Tripathi is followed. But while recording the lecture, I have consulted various other books also. Like I have consulted the Katzeng also, as well as Goodman Gilman. But I didn't stop here only, because I consulted the Medicine Harrison also, plus OBG books also, Ophtha book also. Because pharma is all about the treatment, like how you treat a different disease. So disease does not mean only the one field. Like there are total around 16 or 17 fields are there. Like Ophtha is there, ENT is there, medicine is there, like we have the other fields like pediatrics is there, gynae is there. You should be knowing the treatment of all this disease. And if you don't know the pathophysiology, how will you treat it? So my approach is, I have consulted various books, I have collected the content, and this is given to you in a kind of a cooked manner, so that you will be able to grasp it, easy to imbibe it, make the notes in a very easy manner, and you will get a clinical touch of that, like how to approach this disease, how to give a drug to a patient. This is my second approach, like which I have followed. First is like I always stress upon the thing that you are able to treat a patient. You will be able to write a prescription at the end of this lecture. Second, I have consulted all these books and given this content to you. Number three, like Dr. Naseer has already mentioned, Dr. Praveen has mentioned, I always kept in this consideration that you people are ultimately going to write the exam. Like guys, we people are in touch with various professors of your colleges, and whenever we talk them, they always say that, yeah, up till few years back, we had so many things to ask from the students, but now there are so many guidebooks which are there in the market. Students read the MCQ book. Now the students are only the MCQ doctors. They know each and everything, whatever is written in those guidebooks. So I said, sir, so what is your approach now? So he said, I will put a question in the prof exam, which is not there in the guidebook. Like, let's take an example of pharma. In pharmacology, if you read any guidebook, you will not find the topic on the anesthesia drugs, right? So he told me, I will put a question on local anesthetics. I'll put a question on spinal anesthesia. I'll put a long question on that, and then I'll see how the students will mark. Because guys, try to understand their psychology also. Na? They are the professors, right? And if they are asking questions in the Viva exam and you are answering all questions because you have read from the guidebook, then even this is not, good for them. Like a second year student can answer all the questions of a professor who has experience for 20 years. So this is not acceptable to them. So they intentionally put those questions which are not covered in your guides. One more example is like NSAIDs. NSAIDs is like a painkillers. Like we use brufen. Like whenever we have a fever, we use paracetamol. We have brufen. We have the multiple painkillers. Now these painkillers are not asked in the competitive exam. So in none of your guide, you will get these medicines in detail. And do you know, guys, I have recorded these kind of topics in a great depth, so that at least you will have a complete knowledge which painkiller is better for a particular patient suffering from a particular symptoms. So this is the approach which I have followed, so that at least you are able to write the exam, right? So this is the approach, clinical approach. Second is this, and third is so that you can able to attempt your exam. Number four, like my other colleagues have already mentioned, I have also followed this thing, that whatever I am teaching, that should be correlated with your other subjects of the second year, horizontal correlation, as well as with the other subjects of the third and fourth year, that's a vertical correlation with these subjects. And guys, one thing is, like if you ask me whether, sir, we are able to solve MCQ or not, I will say you will solve more than those MCQ. You're not able to solve only the MCQs which are already been asked in your exam, plus you will be able to solve the MCQs which will be asked in your future exams. This is my guarantee for you. And also, we people are there with you for the next 1 year. Whenever you have any doubt, we will keep on having these kind of sessions. You can bring the doubts. You can ask those doubts. Sir, today in this 1 week of time, or in this 15 days of time, we have covered this particular topic and we have faced these kind of problems. So these kind of questions are not able to understand. So we are here for you. We keep on having this kind of sessions with you. We will be in touch in the next 1 year, as long as you people are in second year. So we will be answering all those questions. So this kind of DBMCI support is always with you. And guys, Dr. Mukesh Bhatia started this DBMCI around 1996. At that time, Dr. Mukesh Bhatia never thought of like so much of commercialization can be possible in this field of coaching. He never thought of this thing. So teaching was his passion. So sir once told me one thing, Saurabh, what happened actually? Actually, I was his student only. Sir, he told me, Saurabh, I was treating a patient and suddenly a junior doctor came to me and he even did not know what dose of tramadol need to be given, what dose of Voveron is need to be given. So I really felt ashamed at that time that the doctor of my country, the junior doctor of my country, who's the future doctor of this country, doesn't know how to treat a patient. Sir told me, sir, at that point, I decided I will teach the students free of cost. And he started this institute by teaching the students free of cost by his own. He started teaching with all 19 subjects together. And look today where we have come. So I just want to continue this legacy with you, the legacy of DBMCI with you, so that we'll give you the maximum information, build your strong foundation. And really, guys, I'm telling you, I promise you this thing, that we have given our heart out in this apps. We've given you all the information, whatever is required for your secondary exams. Like if you open it, there is no need to open your textbooks. I have covered each and every word to word. I have covered more than 95% things I have covered in this topic. Notes are easy to be made by you. I've given everything in a point-wise manner so that you can make the notes, you can revise it easily. And each and every word has a concept in pharma. It's not like that you have to mug up the things. Each and every word has a concept. The central nervous system has concept. The anti-cancer drugs have concepts. So each and everything I have covered in detail. So this is my approach of controlling, of making this app. Dr. Praveen, back to you.
Thank you, sir. Thanks a lot. You have wonderfully explained that what is the importance of this app. And surely when you said what was the concept of Dr. Mukesh Bhatia said to start this institute, it actually opened my eyes also. That's a wonderful statement to also share there. I'll just answer a few queries that students have already, put me in a personal message. Number one is, sir, when is this going to open? So this has already been opened right from today. If you want to subscribe to this app, the second prof course, please go to the eGurukul app or the website of dbmci.com, and there you can purchase this app right from today onwards. Okay. Those who have already filled a Google form, that also is available in this link of this video below. Please fill out the Google form. You can also buy it right now. This link is complete in the description of this video. Go down and you'll get that link there. Second question that I just got a few messages here is, sir, will we get a handwritten notes for this also or not? So even though the handwritten notes is the need of the hour, I understand that, but we as faculty here, I can say this in also in with Dr. Saurabh and Dr. Naseer, because I've spoken to them, that making your own note is gold. That is one thing you must all follow. However, suppose, for example, you have missed something or you are in dire need of a handwritten notes, in that case, this notes is also available for an extra amount that you have to pay. But honestly speaking, I think second year mein to itna to karna chahiye, that you should make your own notes, and that should be purely your own handwritten notes, because we also have written it. We have not taken PPT at all. None. I don't think that. Mr. Saurabh, Mr. Naseer, आपने कोई PPT use किया है क्या?
No,
No, sir,
never.
not.
And
Never,
Dr.
never.
Praveen, this is what the concept of Gurukul is. Do you remember that Mahabharata? Every Mahabharata, those princes have had to go to the Gurukul. Like it's not like they are the son of the king. It's not like that the guru is coming to them in the palace to teach them. They had to go to the guru, and then they had to do all this hard work. This is what the Gurukul is. And if you do the hard work, then only the Arjun is created.
And also, sir, what I tell you is, if you are writing, it is not just printing on the notes, it is printing in your brain.
Exactly.
If you're not writing, it is just there on the notes. It is difficult to get imprinted in your brain. So that's why always you have to write your own notes. And also, I want to answer one of the questions which is repeating here. So you always remember one thing: change is a sign of betterment, guys. Right? If something is not changing, if it is constant, then it is not moving towards betterment. Right? The hard work is not going on. If hard work is going on, right? If it is moving towards the betterment, then obviously minute change you have to expect every time. Change is a sign of betterment. Remember that. So, to you, sir.
Maybe, sir, this is a big statement.
So, and it is
And that's always so good. That's very,
Yeah.
very briefly said, sir. And I'm very sure that students will surely appreciate this. That's always for your good. So, dekho, two things I have explained to you. Number one, the subscription is opening right from today. The link of that is given in the description of this video below. Secondly, that the handwritten notes will be available separately, but we insist on you making your own notes. That is second thing. And thirdly, as Dr. Saurabh Bhatia said, that we will be coming in this forum, in this YouTube channel again and again, just to solve your queries. If you have gone to the previous history, we have been doing the doubt solving session in the YouTube month and month again. If you want, we can do it fortnightly also. Depends upon how much your queries are. One more thing, देखो ऐसा हो सकता है that propose a topic of A to Z is there, and we have left out a topic of G because we don't feel that's important. Your feedback into that topic would be important. If you feel and if we feel, both of us mutually feel that yes, the topic can be and can be accommodated, we'll surely do that. That is the importance of remaining in touch with the faculties when you're joining our course. We are bound to, and we are committed to you to ensure to that you get the best result in your second prof and the next most importantly coming up. So final words from you, Dr. Saurabh and Dr. Naseer. Thank you.
Dr. Naseer, please.
Yeah. So finally, I want to tell, sir, we are not here to market our app and all. Sir, we are here to tell you what change we have, brought, and how it is going to help you, right? So how you can make use of it, right? Kitna benefit aap usse utha sakte ho, right? One thing that I already told, DBMCI is having the best faculty that I guarantee. If you have any doubts, you can ask me. You can ask me the DBMCI Premier Facebook ka group. Otherwise, you can ask me in the Telegram DBMCI Premier group. Any queries you have, right? Telegram DBMCI Premier group and Facebook Premier group. In the Facebook DBMCI Premier group, in the Facebook, you can ask any doubt, right, related to anything. I can answer there. So one thing is DBMC is having the best faculty. Second thing is eGurukul is the only platform which is having, right, both PG videos and concept videos, right, covering the prof and also the entrance examination. And third thing, DBMC is the only platform, or eGurukul is the only platform which is having both the types of videos in microbiology, that is organism based and system based, right? I have recorded the organism based microbiology also, which is the older pattern, and we have system based microbiology also, which is the new pattern, that is the CBME pattern, which is the vertical integration, where we study microbiology systemically from central nervous system, cardiovascular system, respiratory, GIT, GUT to musculoskeletal, each and every system. So this kind of system-based microbiology, that is CBME-based, pattern-based microbiology, you won't get in any other app other than eGurukul app. This is the only app where you get microbiology in the CBME pattern, and this is the only app where you get concept videos. That's what I wanted to deliver today. If you follow this eGurukul app and DBMCI blindly, you will never regret in your life. Thank you. That is from my side.
Nice words, Dr. Naseer, Dr. Praveen. So in last, what would I say? I will only say that medical science is an ever-changing field. And now the education is also going to be. We as a DBMCI faculties, plus as a whole team of DBMCI, wants to bring the change in the education field. We as a DBMCI team, along with you, want to bring this change in the field of education. Change to bring a foundation, to build a foundation on which a tall building can stand out tomorrow. You people are our base. We want to build your base so that tomorrow you will be a shining doctors of future. Guys, let's come together, bring this change. We are here for you always. Thank you.
Thank you, everyone. Thank you.